Good afternoon. Thanks everybody for being here, and a special thanks to everybody who's watching online from across the state. This is the global pandemic that we're facing requires a whole government and a whole community approach. So each of you that are taking the time to dial in or watch today online or watching this at a later date, we appreciate your investment in time, because educated citizenry is going to be key to us achieving our objective of saving lives. And again, starting from the top in terms of strategy, the goal that we have is to try to slow the rate of infection of the COVID-19 pandemic that we're experiencing. As we know from taking a look at other states and other countries who are experiencing a rapid, steep increase in cases, as we've seen in Italy, now we're seeing this in New York, we're seeing it in California. That's a lens into the future. People might say, we don't know what's going to happen, but there's not anyone that has not any geography in the world that is going to be immune to having this pandemic arrive on its doorstep. It is here in North Dakota. We do have community spread, and we're going to continue to see more cases coming. And right now, in a world where there's no vaccine, the best way for us to approach this is to slow the rate of transmission. And while we cannot change the nature and the character of the virus in terms of how contagious the virus is, we can change our own behavior to reduce the likelihood of transmission. And when we reduce the likelihood of transmission, then we, as we've been saying, flatten the curve. We have an opportunity to stay below the line of what our capacity is for medical services. So we're working this problem in two ways. If the goal is to save lives, there's two things we're doing. One is all the social distancing policies, which slow the rate of transmission. And on the other side, we've got task force working very hard about what do we do to make sure that we've got enough beds, enough personnel, enough ventilators, enough equipment to be able to handle the crunch when it may arrive here as it has arrived in other states. So it's a classic supply and demand. We're trying to reduce the demand for medical services by slowing the rate of transmission, and we're trying to increase the supply by working on all the aspects of the supply chain to make sure that we have that capability. So again, and the strategy for working both sides of this is to save lives. And so again, as we've said multiple times this week, this has a higher than the flu mortality rate for elderly and those that are at risk due to chronic underlying health issues, and that could represent as much as 20% of the population of North Dakota being at risk. So those of you that are practicing what we call being North Dakota smart, you are our heroes. Thank you for not only your compliance, thanks for your proactivity, thanks for doing everything you can to keep not only your family, your neighbors, your employees safe, but you're doing that for people that you may not even know. So that's the high-level strategy. Today, North Dakota Department of Health confirmed 7 additional cases of the novel coronavirus or COVID-19, and that includes at least 1 more additional case of community spread. That means 6 of those cases either have not yet been confirmed community or they were confirmed travel. The 7 new cases came across 4 different counties, 2 more in Burley County, 3 in Morton County, 1 in Ramsey County, and 1 in Pierce County. And in Pierce County, that would be in north central North Dakota. People might think of that as one of our rural counties, but I would just use this as an indication for those people in our rural area that think that this is something that only happens in areas of larger population like New York or California, or in larger cities like Fargo or Bismarck. As we've seen in other parts of the world, this has the ability to spread to even the most rural parts of countries or nations, and it has the potential to spread to the most rural areas in North Dakota. Yesterday, we announced that we had our first hospitalization. We have a second individual, so now we have 2 individuals in North Dakota who are hospitalized. And of course, we our thoughts and prayers are with anybody who has not only contracted this, but finds himself in a position where it's become a serious illness. Totals to date through the North Dakota Department of Health, 938 tested, 912 negative to the 26 positive, and we have substantially ramped up our testing capacity, and we're going to continue to do that heading into next week. Yesterday we had 12 new cases out of 311 tests. Today we had 7 new cases out of 265, and that's the 7 that we're reporting today. So the good news is that we had fewer new cases today than we had the day before, and hopefully what this means is that steps we're taking to encourage social distancing is helping to slow the spread of COVID-19 and slow the growth rate of positive cases. The bad news is that we had 2 additional counties in addition to Pierce and Ramsey, and for those that are don't have their North Dakota maps at hand, the county seat of Pierce is Rugby and the county seat of Ramsey is Devils Lake. But those are 2 new counties where they now have reported cases. Again, this leads us to the understanding that our entire state has to practice social distancing. And again, number 1, if you're at all not feeling well, please stay home if you're sick, even if it's minor. But having said all that, again, North Dakota remains well prepared and well positioned to deal with this, because we are one of the last places in North America where it's reaching. And so again, we can look at other states that are weeks ahead of us and see what our future may hold. And we know that in other states they are having situations of really strains on terms of their capacity in terms of medical facilities. We've talked before about exponential growth and what that could mean. And when things double and keep doubling, that's when things get really stressed. It took over 3 months for the world to experience 100,000 cases of COVID-19. It took only 12 days for the world to experience the next 100,000 cases of COVID-19. Again, then you can understand how you can, if that as that doubling may continue, that quickly we're in a situation where we're really stressed for resources. So again, the planning that's going on today, the precautions that are going on today are likely going to give us the capacity to help us get through this. And just for those that are the press that are here, and others that are asking, coronavirus is not taking the weekend off. Neither are we, any of us that are working in state government, those that are working as part of the Unified Command across all of our different work streams. We'll continue to be working throughout the weekend, and we'll also be having press briefings tomorrow at 4 p.m. and Sunday at 4 p.m. for those that are in the press or those that are watching online. Yesterday, I signed an executive order which was deregulatory in nature and helped us work on the capacity side of the problem. How do we make sure that when the crunch comes that we have enough healthcare workers to work in North Dakota? And that executive order allowed that if someone was appropriately licensed in other state, they could work in North Dakota. We've expanded that executive order today to include one more category of workers, and that's folks that work in radiology and medical imagery, including the med techs or the radiology techs that would work in that. And again, this helps us on the supply side to make sure that we have enough personnel. We also have, as part of that same executive order, expanded the order to allow for expanded services across our state through telehealth. Telehealth has been around for a long time, but as a lot of things in the health industry, highly regulated. And what we're doing is cutting through lots of red tape to allow more fields of medicine to be able to practice through telehealth. And I want to give a shout out to our independently elected North Dakota Insurance Commissioner, John Gottfried, who's been working shoulder to shoulder with us on this. And he's working on changing a bunch of rules within the deregulation on the insurance side to expand what telehealth activities could actually be reimbursed. And this is, again, going to allow us to practice social distancing and is also going to help serve the more rural parts of the state. And again, we have the technology to deliver healthcare and behavioral health services remotely. We should use it. Perhaps we should be using it all the time, but with this emergency order, it's going to speed up our ability to deliver our ability to do that. So again, that's a new executive order on telehealth. Unemployment insurance. We've also got an executive order that's gone out today that is going to dramatically reduce the red tape around applying for unemployment insurance and getting an unemployment check. We're doing this through executive order. Part of the reason we're doing this, of course, is we know that in addition to the health challenge that we're battling, we know that in the way you fight a pandemic when you don't have a vaccine is you fight it through slowing the spread, and the way you slow the spread is through social distancing. But what that means is we've got a lot of businesses that have either closed voluntarily or with executive orders yesterday being asked to change their business models. For example, to be able to do curbside takeout or drive-through in the case of restaurants. So we know that we're creating economic hardship with the decisions we're made to try to protect the health of our citizens in the state of North Dakota. But with that is going to come unemployment. And then it's also compounded by the fact that earlier at the beginning of this global pandemic, we did see a demand shock when you start stopping the supply chains with all the ships coming from China to the U.S., when you stop international flights, when people stop commuting to work, you create a demand shock, a drop in demand. And one of the areas where there's been a substantial demand shock drop has been in the use of transportation fuels. North Dakota is the second largest oil producer in the nation, has benefited mightily from strong economies and our position of being able to deliver energy to the world. But in this case now, when we have a slowdown, then also gets compounded by some international politics between Saudi Arabia and Russia. And we've seen a drop of almost a drop in half in the price of oil prices. And so as a fallout of the global pandemic, we're seeing a drop in price, but that drop in price is causing a number of energy companies that work in North Dakota across all aspects of oil and gas to have to think about start doing layoffs. And so the combination of the demand shock for oil plus the unemployment claims that may be starting to come in from executive orders, we're seeing, as we expected, an increase in unemployment claims. We had 418 claims in unemployment of all of last week. So think of that as about averaging a week ago about 80 claims a day. Wednesday of this week, we had 600 claims. Yesterday, 1,600. So this is a trend line which we're likely going to see, as we've seen all over the country, where the COVID-related issues to unemployment, but also the economic fallout related to COVID-19. So again, to the executive order that we've signed today in terms of cutting red tape so people have an easier time filing claims for unemployment benefits during these extraordinary circumstances, and these changes in the executive order, which are quite detailed, significantly reduce the administrative workload on our team, because you can imagine a team that was processing 80 a day, now facing 1,600 and growing, is quite, and we're trying to reduce the administrative burden so we can process these and get checks out to people faster. So there's a number of changes that are being made, but at a high level, separation from last employer, which is one of the qualifications, that we're waiving or reducing requirements there. And the net result of all this is a significantly greater percentage of claims will be paid than under normal circumstances. This will also reduce the amount of inquiries being sent to employers and claimants, because sometimes if there was a claim made, a lot of investigative time to try to qualify that claim. With all this disruptions, employers may not even be at their place of business to be able to respond to mailings or emails from job service. And so again, taking these steps. I want to thank Brian Klipfel, who's in the audience today, for his leadership. He's leading both workforce safety insurance right now and job service, and want to thank he and his teams, but the teams at Job Service are stepping up to manage unprecedented rapid increase in claims. But fortunately, the changes that we're describing here are relatively easy from an IT system to be able to implement because no system changes are required. And this applies to all businesses, not just those that were impacted through our executive orders for closures. So if anybody in our state is recently become unemployed, contact Job Service and for their information. This has led to questions about the size of the unemployment insurance fund and the backstop on the unemployment insurance fund, but we've done some checking on that. There is the ability that stands today for states in their unemployment insurance funds to borrow at zero interest from the federal government. With all the action going on in Congress, we think that is likely going to be one of the ways that perhaps dollars will be channeled to states. Lieutenant Governor and I are advocating to all of our federal CODEL and other federal officials at the administrative level that one of the great ways to support states during this time frame would be to channel some of the funding that's coming out of Congress into supporting the unemployment system. And secondly, if that federal backstop isn't enough, there is the existing statutory ability for Job Service to take a loan out from the Bank of North Dakota. So people that are thinking about their unemployment benefits should know with confidence that there's going to be funds there to pay those unemployment benefits either at the federal level or the state level. Okay, to learn more about this, you can visit the Commerce Department's employer page, and then Commerce Department and GNDC will be hosting another business briefing call next Thursday, March 26th at 11 a.m. The GNDC, that would be the Greater North Dakota Chamber. You can find details pertaining to this call at the Commerce Department's employer page, and again, Job Service North Dakota, if you're looking to learn about unemployment benefits. At that call last week, there was over 1,000 people on the call from businesses around the state. Next topic, state agency deadlines and D.O.T. We are looking across state government for ways to help citizens during these trying times, looking to reduce regulations that get in the way of assisting our citizens and those citizens who are trying to help those that are most vulnerable and those that are seeking to try to continue to do their regular business with the state of North Dakota as the state of North Dakota remains open for business. We're just trying to deliver those business and agency services in new ways with many of our workers working remotely. But with a focus on that service, today I signed an executive order directing all state agencies to identify provisions of law or administrative rules that in any way prevents, hinders, or delays that agency's ability to render maximum assistance or to continue to deliver essential services to citizens during the COVID crisis. This is as part of this executive order, we're asking that all agencies submit ideas, essentially identifying the constraints that may exist in existing law or existing administrative rules that are preventing them from serving our citizens. And so this is, again, trying to take a look at the bureaucracy that exists and how do we cut through it and cut through it rapidly to help those citizens and businesses in our state that may be impaired by the current situation. The order, it requires state agencies to identify law or regulation that would delay citizens or businesses, for example, for obtaining or renewing any sort of license or certification. And of utmost importance, we're asking these agencies to look at services related to health, to education, to employment. So with a special focus on that. We're asking that those agencies submit those to the governor's office. We are also inviting, as part of this executive order, inviting all other elected officials in the state and their offices to do the same, which is if they've got things that other electeds are running into, John Gottfried, Insurance Commissioner, been a great example. He's identifying things that were in the way of us providing telehealth. He brought them to the governor's office. We weren't able to include that in the executive order today to create greater ability for us to deliver healthcare services in a way where we're still practicing social distancing. So we're inviting all the other electeds to follow that lead, and we're requiring all agencies to come forward with ideas. But we know that some of the best ideas ideas that we're getting. We know our office, Brent and I personally, getting calls and texts from citizens and saying, hey, what about this? I tried to do this. I needed to get a license for that. I couldn't do it. We want to hear those ideas. So all citizens are also invited to submit ideas where government red tape during these times is getting in the way of you doing the things you need to do, and you can submit those to governor@nd.gov. One example of this is example of where we're already being proactive along this whole area of trying to reduce and cut through red tape to help our citizens during this time is that we're, as part of the executive order today, we're ordering that all organizations that provide services to citizens or business, all North Dakota law enforcement agencies, private sector businesses operating in the state are hereby directed to recognize any North Dakota driver's license or North Dakota motor vehicle registration that are still within their time period, but we also are asking anybody to recognize driver's license and motor vehicle registrations even if they've expired on or after March 1 of 2020. So this order effectively, if your driver's license ran out the other day and you're worried, or you got a family member that's sick and you didn't want to come in or weren't able to conduct that online, your driver's license is still valid today, as is your motor vehicle registration. So again, that is valid and current as long as this executive order is in effect, and the executive order will remain in effect until the emergency ends. So this is an example of things that we can do to relieve burdens on citizen and also reduce contact. I'm going to take a short break here, and I'm going to invite Molly Howell, who's the North Dakota Assistant Director of Disease Control, to talk a little bit about how we do contact tracing. I know we had a number of questions about this in the past. She's one of the great hardworking experts that we have within the Department of Health, and so we'll let her do that. And then when I come back, we're going to talk about some new, fresh announcements around SBA loans. But here's Molly. Molly?
Thank you, Governor Burgum. Thank you for having me today. I just wanted to start off by thanking all of the epidemiologists and disease investigators that have been working really hard, even prior to seeing cases of COVID-19, in preparing and planning to see cases. And also I want to say thank you to their family members, because they maybe haven't seen their spouses in a while. And thank you to the family members for taking care of the household and also the children in the household during this. And then we also have had local public health departments and our health professional schools also offer to help us do case investigations, which we plan on taking them up on that in the very near future. So today I just wanted to talk about what happens when we get a report of someone who tested positive for the novel coronavirus, COVID-19, what that means at the Department of Health, and what that means for the public and how we handle that. And so we get positive lab reports electronically. So as soon as it's positive at the lab, that is immediately sent electronically to the Division of Disease Control, and also the health care provider is one of the first people notified of the positive result. Then an epidemiologist from the Division of Disease Control contacts that individual, which we're calling a case, and interviews that individual. The interviews so far have been taking up to an hour. As a part of that interview, we're gathering information from the person, including basic demographics, but also what symptoms they've had, where they went in the 14 days prior to becoming sick, so we can try and identify the source of the illness, and then also where they've been, if they've been anywhere since they've been sick. And that's so we can identify close contacts or areas of concern that we need to follow up on. We also get their employment, if they attend school, anything like that. And then when we identify close contacts, and so a close contact is anyone that's within 6 feet for a prolonged period of time, and at the Department of Health, we're using about 15 minutes. And a close contact can occur if you're living with someone, so all household contacts are considered close contacts, but also if you're riding in a car with someone for a prolonged period of time, if you're working closely in an office with someone for a prolonged period of time. A close contact is not if you're in the same restaurant as somebody else that might have COVID-19. And so if you were eating across the table with someone with COVID-19, you would be identified as a close contact. But if you were just in the same restaurant, you would not be identified as a close contact. And so then we follow up with all those close contacts. And then we ask them questions about if they're symptomatic. We advise them to stay home for 2 weeks. That would be the minimum time period from the last time they were exposed to somebody with COVID-19. If they have symptoms, those individuals are being referred in for testing. We don't want them to go right to the healthcare provider for testing. And so we are coordinating that with the healthcare providers so they know someone that was a contact to a case is coming in for testing, and they're aware of that and can take appropriate precautions so we don't spread illness in the healthcare facility. We follow up with these individuals and monitor the contacts and the cases. The cases are monitored the entire time they're contagious, which is 7 days after their onset of symptoms, and they have to be fever-free and feeling better. The fever-free is 72 hours, fever-free without the use of meds, and their symptoms have to be feeling better. So the minimum time period is 7 days after onset, but it can be longer if they still have a fever. So we follow up with the contacts and the cases and check for symptoms and make sure they're staying home. And then we answer any questions that they might have or provide education. We have fact sheets that we give cases and contacts so they know how to prevent transmission in the household. If through our investigation, we identify that someone was on an airplane with COVID-19, we notify the Centers for Disease Control, and they provide us with close contacts that were on the airline for us to follow up with. If anyone was in a ride share, we follow up with ride share organizations, and they tell us who the close contacts are, and we follow up with those individuals. So I guess the basic message I wanted to say, if you're a close contact to somebody who's been positive for COVID-19, you will receive a phone call from the North Dakota Department of Health or the local public health department notifying you that you're a close contact. And then we will inform you of what steps you need to take next. The reason I wanted to share this with everyone today is there's a lot of rumors on the internet, a lot of social media posts about restaurants or places where cases might have been. But really, we will notify everyone if you were a close contact, if you were identified through our case investigation. If it's a school or a daycare, we'll work with the school or daycare. We'll send letters out to all the parents. And so I hope this makes the public feel better about what we're doing to try to reduce the spread of coronavirus in North Dakota.
Thank you, Molly. Molly will be available for questions at the end. Next up is SBA loans. As you know, one of the other work streams that we have going on with our whole of government approach is to bring together all the different organizations and state agencies that have an impact on economics in the state, and that would be include everybody from our Department of Ag, our Department of Commerce, the Bank of North Dakota, workforce insurance, unemployment. We've got all the leaders working together to try to make sure that we're calling our Economic Resiliency Task Force to coordinate information about COVID-19 and make it easy access for North Dakota employers and businesses. The tax department, the insurance department, Department of Labor and Human Rights, Greater North Dakota Chamber, local regional chambers, economic development organizations are also part of this organization. Department of Commerce is taking the lead, and since Monday, on Monday they launched a one-stop employer research page combining information across all these organizations. So if you're an employer, a small business owner, an entrepreneur, again, the North Dakota Department of Commerce is the place to go for your one-stop for all this information. As I said earlier, we had a call earlier this week with over 1,000 participants. That included presentations from the leaders from all these different groups. There's a recording of that call that's available on the Commerce Department's dedicated COVID-19 Business and Employer Research page. And again, the great information from those leaders that's out there if employers missed that Thursday call, and we'll be having another one next week. One of the things that we did talk about during that call call was urging employers who experience or anticipating financial strain to prepare to apply for disaster loan assistance through the Small Business Administration. That was, I guess, just on Wednesday. Since that time, North Dakota has been approved to begin submitting applications, and the SBA site is now receiving applications. So we believe, and that's just very current. We got an email to the state of North Dakota at 1:20 this afternoon saying it would be live in an hour. We'll follow up with that, but the site should be live now. That's the SBA site. Disasterloan.sba.gov is the place to go. Anyway, you can find out information there again, or just go straight to our North Dakota Department of Commerce site, and we can redirect. But this is a $7 billion fund for low interest loans, up to $2 million per business to cover working capital, operating expenses, and more. But as this was set up, as for this first tranche, it's a first come, first serve. We urge anybody who's thinking of applying for an SBA loan to apply now, and you can find that and other disaster-related financial resources at nd.gov. That concludes the SBA portion. The last thing, we had questions the other day. I've got an update on rest areas in North Dakota. Rest areas were closed earlier this week. Our intention, because we understand the importance for how important transportation is, and the folks that are out there with commercial driver's license delivering food, supplies, medical supplies, it's important to keep that going. And so all of our rest areas, while the buildings still remain closed this week, our intention is that they will be reopened next week. The Department of Transportation is conducting deep cleaning, and sadly, we're also having to do a bunch of repairs because there was vandalism at the rest area sites. This included people using crowbars to try to access storage areas. Apparently the demand for toilet paper was so high that people felt they had to take to criminal activity to try to access that. It's super sad, and I hope that is, we'll make the assumption that was somebody passing through our state and not a caring North Dakotan who cares about their neighbors. But again, we intend to open those up. We're working to add additional custodial and janitorial services to make sure that they've got regular cleaning. People should still make sure that they're practicing their own hygiene and hand hygiene whenever they come into contact with public buildings. But we're going to work to get those open. In the meantime, the parking lot areas do remain open to the public. So if you need a chance to take a break when you're driving, or truckers that might need a rest area overnight, the parking lots are open, and the buildings will reopen again next week. One other thing I want to address too is relates to when we talk about misinformation. There was rumors flying all over the country today that somehow there was going to be a presidential order about mobilizing the National Guard nationally. We heard the president say today around noon in his noon Central Time in their press conference that was not going to happen. Adjutant General Alan Dorman, who is also the Director of Emergency Services for the state of North Dakota and part of the cabinet. General Dorman was on a call at 3 o'clock today, just an hour before this call, with the Secretary of Defense and all the Adjutant Generals from around the country, and that is not happening. And so it was said that, quote from that call, "It makes much more sense to leave them under state control so they can be mobilized as needed, one piece at a time." That was from General Engel, said that during this call. And again, the president said, "We are working with the governors." He referenced his governor's calls, which they're having at least twice a week. I don't think that we'll ever find that necessary. So again, we'd like to squash that rumor, and people know that the National Guard continues to be a key component of our emergency response, but they remain under the direction of the governors of this country, as we and every other governor through the National Governors Association. We had a National Governors Association call the other day, and Larry Hogan, who leads the Governors Association, governor from Maryland, was echoing that on behalf of all the governors. And as chair of Western Governors, I can assure you that all the Western governors are also in agreement that National Guard should remain under the authority authority, managed under the authority of governors and not move to the federal government. So let's squash that one. Now we're going to go to squash that rumor. Let's go to questions. And Jack?
Do you have a theory, Governor, why so many cases in Burley-Morton compared to other counties in the state?
The question was, do I have a theory about why so many cases in Burley-Morton versus others? And rather than me conjecture a theory, I might look to Molly, and then Molly will have to either answer or not answer based on what we do share or don't share relative to personal information. But Molly, if you want to step up here, if you got a theory about why we're...
Yeah, it's not a theory. I'm trying to think how I can answer your question with trying not to identify individuals. So we've had a number of cases in the area that traveled. Most of our cases have traveled out of state, and that's the reason for their illness in the Burley-Morton County area.
But we also do have community spread here.
Yes, but there is community spread. So, but the majority have traveled out of state. And then, of course, there has been some community spread.
The third largest county in the state still has no confirmed cases as of this point. It's Grand Forks County. Is there testing available there in the way that there is in Burley County, Morton County, Cass County, and everywhere else that there have been confirmed cases?
Question was, the third largest county still has no reported cases, and that'd be Grand Forks County. And further question was, do they have the same access to testing resources as the rest of the state? And the answer is yes, that they do. And I'm certain that they're, at least of yesterday, I think we had tests submitted from 32 different counties, and I'm certain that they were part of that 32. Dave?
You mentioned low interest loans from the SBA. What is the interest rate?
The question was that I mentioned low interest loans from the SBA. What is the rate? I don't actually know what the rate is. I know that we're in unprecedented times here because it was, I guess, a week ago, just last Sunday, Federal Reserve, lowered the federal funds rate to 0 for the first time in modern history, maybe the entire history since Federal Reserve was formed in 1914. We'd have to go back and look, but I'm given the bipartisan approach to try to support small businesses, that number is going to be, I'm going to say it's going to be very low. I mean, it's going to be, we're looking at historic low interest rates, and we may be in a period, again, where lower than we've ever seen as we try to work our way through this economic crisis. Okay, the number just came in, 3.75. That doesn't sound that low to me. I'm going to say that number will likely be adjusted down. The federal government, if you're talking about writing checks, they're considering giving a check to every American. I don't think that policy-wise that it would make any sense for us to be charging an interest rate that's substantially higher than the Fed's fund rate through the SBI. But we'll continue to provide feedback to our federal partners in that regard, but I would think that it is low as could be when you're talking about the federal government issuing those loans would be the right policy right now. Dave, follow-on question?
Because a restaurant owner in Fargo suggested to at least a couple of members of the media today that maybe the state could use the legacy fund to do bridge loans, especially for restaurateurs. Any thoughts about that?
Question came up that was framed from a restaurant owner in Fargo was, could the state use the legacy fund as a possibility for low interest bridge loans for restaurateurs? And again, I want to separate policy from the source of where the money may come, because I think one of the big buckets of money that the citizens of North Dakota have come to know is this essentially our endowment fund for our future, called the Legacy Fund. The earnings off the Legacy Fund today by statute come into the general fund and are used to help fund general government. I think the opportunity for us to do loan programs out of our bank in North Dakota, one thing that we have that no other state has is a state bank. And so it's more likely and potentially could low interest loan programs to help businesses could come out of the Bank of North Dakota. Dakota without any legislative action, because the bank could decide to do that. So separating the policy from where the source of the money comes, the first and fastest place we could look to would be the Bank of North Dakota for potential loan options, and I'm sure we're going to have a lot of ideas around this, and I think there's going to be special consideration because, you know, this is the first time where the state has asked businesses to close. I mean, we're directly responsible. We're asking them to undergo some economic challenges to help us, you know, solve a healthcare crisis, and therefore, because we've asked them to do that, we were probably under more responsibility to find ways to help them on the backside. Brent, anything you want to add to that, or thumbs up from Jack?
Question for Molly about close contacts. Just wondering if you can say how many people have been identified, have any been tested positive for COVID-19?
The question was for the close contacts, how many have been identified and have they been tested and been positive? I will take the second part of that because it's easier. Yes, we have had close contacts that have been tested and have tested positive of cases, so that's included in the case counts. In part of the number of individuals currently monitoring, those are contacts to confirmed cases of COVID-19. Some of those in the currently monitoring are also people who have traveled to North Dakota from the level 3 countries that have warnings that we're notified of, but the vast majority in the currently monitoring are close contacts.
A question from Renee Jean with the Wilson Herald out of Wilson's Online. She's wondering about ventilator capacity. Where are we at? What steps are taken to expand ventilator capacity in North Dakota?
Okay, question coming in from the Williston Herald about ventilator capacity and where we are in terms of steps to increase ventilator capacity. And same update as I have yesterday. We've got a dynamic infographic that's posted on the healthcare site that shows number of ventilators in the state by geographic location, and then also the those that are in the supply chain, where we know that there are some health organizations that have made requests. We heard today in the White House press briefing that through the Defense Production Act that was enacted earlier this week, where the federal administration is going to be working with industry to try to increase production of ventilators. I think I saw a number that came out of that as like 20,000 nationally. There is also a work stream that we're pursuing here in state to try to find out about retrofitting ventilators that may exist to be able to use, that might have been used for anesthesiology, for example, post-elective surgery. Other states, it's been recommended nationally that elective surgeries cease. That's been a national recommendation. Here we're letting individual healthcare organizations make that decision, because with only 2 hospitalizations, they may still have the capacity to proceed with electives for a while, but at some point, if we become capacity constrained, then that may go from a recommendation to more of a mandate, but that would free up additional capacity as well. But we do have, as part of our Unified Command Task Force, we've got people that are working that continue to work on ventilators, ventilator access, and ventilator supply chain is one of the key components. But I'd say our team's got a handle on it right now, and we're going to try to keep growing that number. But again, capacity, do we have beds? Yes, we got beds, and if we don't have enough beds, we can convert facilities that can be made into beds. General Dorman and I had a call earlier today with a general from the Army Corps of Engineers. Through the FEMA declaration that was given yesterday, the Army Corps of Engineers has been asked and given an assignment in our region to help stand up temporary hospitals. So ideas that we've talked about here earlier about could you convert a university dorm to beds that could be used, or could we take a rural critical access care hospital and convert that entirely to a COVID facility. Those are exactly the kinds of things that the general from the Army Corps of Engineers both has got funding and personnel and equipment that they could come in and try to stand them up. I mean, they even talked about putting them up in gymnasiums, but we probably have got better solutions than that with dorms or critical access care hospitals. But there is work coordination between the states and the feds coming through FEMA, through Army Corps of Engineers, and our state unified command to try to identify potential sites if we need to get that. So we take care of beds, take care of ventilators, and as we said earlier through the executive orders, we're trying to make sure we got the right supply of healthcare workers. But then when we're protecting those that are most vulnerable, it's not just with underlying health diseases and people that are elderly, it's also our healthcare workers. And so we have to take special care that we're protecting those because other places that have seen the spikes like Italy, healthcare workers start getting COVID, then they're sidelined. And when they're sidelined, then how do you backfill that? So again, we have to always, when we're talking about the definition of those most vulnerable, we're talking about taking care of our healthcare workers. So working all those streams, beds, ventilators, and healthcare workers to make sure we're trying to avoid the spike happening, but if it comes, we want to be ready.
Follow up on the ventilator question. On this graphic on the website, it has 286 ventilators listed statewide. There's been a distinction in the past between ventilators that are available right now for COVID patients versus total ventilators that could eventually be used for that purpose. Are these 286 ventilators able to be used right now for COVID-19 patients?
I won't repeat the entire question, but I love the precision of the question, Jeremy. And it was, he's got the website up in front of him. He says there's 286 ventilators on there, and the question is, are those the ones that are available right now, or are those the ones that could be available? And if you're having to ask me that question, then I would tell you that we need to have a better label on that graph. So we'll update the graph so that anybody that looks at it will have that answer.
Governor, a quick one and then a longer one. Rest areas opening up next week. Is that Sunday or Monday?
They're going to open up on a rolling basis, and so when we say next week, I think the first ones are going to start opening on Monday, but they're going to roll as they're able to complete these repairs from the vandalism.
And other states and cities are announcing the seek shelter policies. Reports say that Minnesota is just a matter of time before they announce theirs. What conversations are happening in your office, and what's the latest on the thresholds to announce that kind of thing?
Question was about other states that are enacting the shelter in place or shelter at home policies that you've seen coming out of areas where we've had the highest number of outbreaks, in New York and California specifically, and it was suggested that Minnesota was thinking about it, and what kind of conversations are we having here as we think about our response to this. That's ultimately one of the places that we have to consider. But again, I think that one of the reasons why that gets put in place is that in other places where you see escalating amounts of government mandates is when it's in reverse perhaps to what I'll call what we're asking for and have always asked for in terms of individual responsibility. If everybody in our state was practicing social distancing, if everybody was doing all the recommendations that we're giving, then we wouldn't need to put mandates or requirements or executive orders, because it would all just be happening. But what happens is some people start complying, and then they might see their neighbor, their competitor not, and then we start getting the calls and saying, hey, you folks have got to decide centrally to make a decision, but we're going to just continue to make an appeal to everybody for a state that prides itself in individual responsibility and people that want to have their freedom if we want to preserve our freedom, let's use it wisely, which is make sure that we're acting in the best interest of all North Dakotans and not just in a person's own self-interest. So, so all options are on the table. And again, if you want to see what's coming, when you don't control the spike, when you don't have a flat curve, when you have a steep curve, the steeper the curve, then the more drastic the responses have to be made by governments to try to reduce reduce contact, reduce the spread, increase the social distancing. And those two things go hand in hand. So every day is a judgment call here. Every day we're making decisions on incomplete information. And every day we're trying to balance the interests of the citizens of North Dakota, both their health and their economic health, their education, there's a lot of things that we're trying to balance here. But again, I just would ask that if people can practice what we're doing, maybe we can have more days like today where we're not seeing a doubling of cases, but we have to assume that there's more cases out there than what the tests are producing. So that's another piece of incomplete information that when we're making these decisions.
Maybe with a quick follow-up then, Governor. If every day is a reevaluation, gauge for me your level of concern with how steep that curve is right now.
Question was, if every day is reevaluation, then what would be my personal view of concern of where we are? I think that we have to take very seriously the numbers that we're seeing that are coming out of other states. We have to, we can't assume. I think some people might have assumed, hey, well, that's China. That's happening in China. Oh, that's South Korea. If you've never been to China or South Korea, probably seems like someplace that's a long ways away and maybe doesn't apply to us. And then, oh, it's New York and it's LA. Well, that's a long ways away, and those are big metro areas. It doesn't really apply to us. I mean, if we take a path of denial about that it cannot happen here, then we're ignoring the science and ignoring the basic underlying fundamentals of how pandemics work. Because, as I said at one of the earlier conferences, it was one person that traveled to the state of Washington from China that now has led to over 1,000 cases in the state of Washington, and over half the deaths in the country came from that one state. If that person had traveled to Bismarck or Fargo or Grand Forks instead of traveling to Seattle, we'd be on the front page right now. It doesn't necessarily have to have started at the coast. It started where the first people that were carrying it began. That's how pandemics work. We just got lucky that we weren't the front lines. But if that person had taken another couple plane legs and landed here, we could have been Kirkland. Very easily could have been Kirkland. So we cannot live in some world where we're in denial that somehow the geography of distance protects us. It was really a random luck that we did not have somebody that came here with it right away. I mean, so we got extra time to prepare, but with that extra time to prepare, that doesn't mean extra time to try to just continue to reinforce the denial that pandemics don't spread everywhere. The only reason they don't spread everywhere is when you stop travel. And so we're probably also ought to be thanking, the other states that got it first that are reducing travel, because we've got less people traveling from there to here. So that also buys us more time. So if we come out of this better than anybody else, it'll be because social distancing policies were put in aggressively in other places. And somebody might say, oh, well then, you went too far in North Dakota. Well, did we or did we not? Because we maybe are being saved here because of aggressive social distancing policies by other states and other locations that were experiencing higher breakouts. In the end, it's a math game, and we're trying to win. We're trying to win the math game by spreading the rate of infection, by lowering the rate of infection. That's what we're trying to do. Okay, we have one more coming in from on the online questions.
Chris Larson with AM 1100 The Flag out of Fargo. In the beginning, you were looking for better data set whereupon to make decisions. We're almost at 1,000 tests. Do you think it's a more accurate representation, or is there a threshold or a number of tests that you're looking at to make good decisions off of data?
Question was, when we started, we said we want to be data driven. Now we're almost at 1,000 tests. What kind of data sets are we looking for? How do we feel about the data? Well, anyone that's been involved in statistics understands that you got to have a large enough sample to be statistically significant, and 1,000 out of 760,000 North Dakotans is not enough. I mean, that's not a statistical sample of percentage of our population to try to make broad decisions. And we know that the data. One thing we know about the data of testing is that data is lagging. And the data is lagging, meaning that if someone was sick 3 or 4 days ago and then they felt bad, then they got screened, then they got a test, and the test comes back, 8 or 24 hours later, there's a lag to that. So when we said we were sure there was community spread, we said that before we had confirmation of that. When we say that there are no confirmed cases in some of our larger counties, if I was going to make a bet, I would guess that there are cases in those counties. They just haven't been confirmed confirmed yet. And so the testing data is not going to solve the problem for us because it's always going to be lagging. What we can only do then in this situation is and again, the more tests you have in the denominator, then the lower the mortality rate becomes. If you test everybody, in the world, you'd come up with a lower mortality rate. If somebody says the mortality rate is the number of people who died versus the number of people who took the test, the mortality rate's going to look higher than if it was the number of people who died versus all the people who had it, including those who were tested and those who were not tested. But even with that, in the absence of that, all the data would show that this could be 5 times more deadly for elderly people than the flu. And so if we have something that's still unknown, still uncertain, then we have to act. Part of our job in government is to, number one thing we do is the health and safety and welfare of the people of the state of North Dakota. So we're continuing to search for stronger data sets, but in the meantime, we get to make decisions every day without complete data sets. The data we have is latent, and so we can look to data from other states. It's not North Dakota data, but we can look at the curves of those other states and we can see the increase, we can see the doubling, we can see the community spread, and you can project that we are not different from those places. Because the virus doesn't discriminate on geography. It discriminates based on whether it has contact with another person it can pass itself to. And so if it doesn't discriminate on geography, then we are not different from Italy or New York or California where they've had steep climbs. And if we don't have a steep climb here, it will because of the heroic action of people actually executing on social distancing. That will be the reason why it doesn't come here.
You and Mylin had given an update on a shortage of swabs a couple of days ago. That was sort of the holdup in testing. Can you give us an update on that and talk about sort of this potential deal with South Dakota to swab supplies? I know that things have changed there as well, too.
I can give you an update on South Dakota, but Mylin is here. Is there anything on swabs you may want to either come forward or share? But on the South Dakota deal, we were talking about they were short of reagents. We were short of swabs. We thought about swapping swabs for reagent. In our talk between the two health departments, we decided that was not going to work out between the two. I know that Governor Noem on the call with the president and vice president made a specific ask for more reagent. I know the federal agencies were working with her to try to solve that problem in South Dakota. So we think that the South Dakota problem got solved with either national testing organizations or federal support. And then as you've seen here in the numbers, we've continued to ramp up our testing and we'll continue to ramp it up. And so I'll let Mylin, our state health officer from North Dakota, talk about the swab situation.
On the swab situation, we had some really good news, and it came in right before I got here, that South Dakota is offering us 1,000 swabs, and we're in the process of picking them up right now. In addition, the federal government has let us know through the Secretary, Alex Azar, that we're getting 4,000 more swabs, and they should be arriving today or sometime this weekend. So the issue around swabs, I think, is being relieved and being met. In addition, the FDA is working to allow for some different testing methods, and so we're just getting that information right now. As I was sitting in the back of the room, I saw that come in. So our team will take a look at that and then let our providers know what other options there may be.
Just to follow up, are we sending reagents down to South Dakota as part of that?
They got reagents, so we are not at this time.
Is there anything being exchanged?
Right now, no, there's nothing being exchanged. South Dakota met some of our needs.
Before you go to the next question, I'm just saying there was somebody online that said that when we have when these go an hour long, that it should be like a basketball game, so there at least should be one timeout so Lindsay can take a break. But I just want to say that she's the fastest signer in North Dakota. I think she's been keeping up with me all week, and I want to thank her for doing that. And apparently, she's got great stamina. Okay, next question.
I can do one more.
Okay.
So you mentioned these unemployment claims. Are they coming from any particular part of the state or any industry that you notice? Obviously, we've seen really harsh effects on the oil and gas industry.
Yeah, the question was where are the unemployment claims coming from, and we've seen impacts on oil and gas. That's very precise. When they come in, they do get categorized by industry. In this, the numbers that I shared earlier, 600 on Wednesday, 1,600 yesterday. The whole wave of those is coming from the energy industry is where that first wave is coming. I'm guessing that we'll see hospitality and retail and restaurant, that'll start showing up next week. But right now, the first wave was oil and gas. And I see Darren Brostrom over there, who's our unemployment expert and in terms of administrating in North Dakota. Anything you want to add to that, or did I get that one right?
You got it covered.
Okay, he says we got it covered. All right, we're double checking, but thank you, Darren, for being here, and thanks for all the work that everybody is doing as you guys face this crunch over in the in job service unemployment claim area. Another question coming in online.
So this one's from the forum. Have we considered a moratorium on evictions from rental properties in North Dakota?
Question was, have we considered a moratorium on evictions from rental property in North Dakota? And I would say I know that that's been discussed in meetings that I've been in. I don't think we are announcing anything today. I think I might have said yesterday that I know on a national level, Secretary Carson from HUD had indicated that there were going to not be any and I don't know if it was, Fannie Mae, Freddie Mac, HUD, whatever, but on the federal level, I think they put a moratorium in on federal housing. But I know that that's one of the things that's under discussion. And I don't know if there's other experts in the room that have an update on that or not. We'll just take that one as they get back to you with more information.
Last one, I promise. Have the testing criteria changed at all over the last few days?
Has the testing criteria changed over the last few days?
The criteria for being able to get tested.
Okay. Molly, you want to take that one? Okay.
So the testing criteria is really based on local supplies because at the state right now we do have the reagents to do the testing and we are keeping up. And so if in local areas there are shortages of, say, swabs, they can prioritize patients who are hospitalized, those living in congregate settings such as long-term care facilities, healthcare workers, and then people identified through our investigations that we identify as contacts that are symptomatic if they have a local shortage of, say, swabs. And that guidance went out to healthcare providers on March 18th and is posted on our website.
Other questions? Hearing none, to close out today, again, want to close out with again, thanking all the important role that the media is playing here. I want to thank all of our state agency leaders that are working so diligently around the clock to try to deliver solutions. I want to thank all of our mayors and their staffs and county officials because we've been in constant contact. We know there's a lot of work happening across the state at that level. And of course, if you've got every mayor in North Dakota is a part-time position. They've all got other things they're doing. They're dedicated servants, as are all of their city councilmen or city commissioners. So we appreciate what they're doing. The business leaders across the state that are taking the courageous acts to try to help protect the public and their customers and their employees, even when they know that it's going to affect their bottom line. Again, as former business owners, Brent and I understand the challenging and painful and maybe unprecedented decisions that people are having to make, but we thank everybody for that, for all the work that they're doing. And again, in closing, we want to just thank everybody that's focused on facts, not on fear. The way we get through this is we get through it together. We get through it by making sure that we're acting on the best information we have, and we do it by making sure that we're being North Dakota smart. And with that, we can save lives, we can educate our children, and we can get through it, and then we can get back to having one of the best economies in the world right here in North Dakota. We can get that all done hopefully in 2020, but right now we're still at the front end of this thing. We're still in a point where we would expect that we're going to continue to see more cases, not less, and so all the work that's being done on social distancing matters, and really appreciate that. And again, practicing your own great work, washing your hands, keeping your distance, stay home if you're sick. Those are the big three things that people can keep doing that'll actually literally help save lives. So thank you for being here today, and for those in the media, thank you guys for practicing. You're all today more than 6 feet apart. Way to go! And that are in the room, and we'll see you tomorrow at 4 p.m. Thank you.